I'll get you.
All right, so we shall open the meeting at 4:02 on February 6th. And I think if I just say that Jack and Daya and Betsy and Premila and myself, Risha, are all present, we can go ahead and start. I'm bringing up so we have reviewing the minutes from December. Is that right?
From January.
Okay, sorry, the agenda says December, so from January?
Yeah.
Okay. Has anyone had a chance to look at those? Any questions or concerns?
There's just a minor thing, a typo on number 6. It says, and fraudulent activity should be any.
Great, thank you.
Thank you for noticing that. You clearly read the minutes. Thank you, Pamela.
Any other notes or comments? Okay, can I have a motion to approve the minutes then, if no one else has any concerns?
I'll make the motion.
Okay, Premila, make the motion. Any second?
Second.
I saw Jack's hand.
Yeah, I'll second.
Great. So Daya, are you okay with that?
Aye.
Betsy? We'll come back to Betsy. Premila?
Aye.
Jack?
Aye.
Myself, aye. And I guess we'll say it with that. That's a quorum, so. Great. The next item for agenda is public comment. Do we have any? We do.
Yes, we do have one person, Dylan Maxfield, is raising their hand.
Great.
So, Maheen, do you want to allow Dylan to talk? Yeah.
Hello, can you folks hear and see me?
Yeah.
Yes, we can.
Well, thank you so much. My name's Dylan Maxfield. I live at 290 North Pleasant Street here in Amherst. My comment is just about what the things I've been noticing for a couple of food establishments in town. I think we've all noticed what happened over at Oriental Flavor, which I know myself and many other residents and folks from surrounding towns were very disappointed to see that. That they'd shut down, that they'd been unable to meet health standards. And more recently, I'd become aware of the Halal Cart, which operates outside of the Unitarian Church recently, where he's been operating his open food truck for many, many years. I know some time ago he'd purchased an enclosed truck, which he would use during the winters, but he would still switch back over to his open truck whenever it was too hot to operate in there. And now it is my understanding that he's no longer going to be able to operate his open food truck and will have to use the enclosed one. And I believe, if I understood correct, he now has a mandate to install a new sink system in there as well. And maybe this is something I should be going directly to the health department with. I'm not sure if I'm even really in the right place for this one, but my comment here is really more of a question of, I understand that we have these health regulations in place, and the idea is, my assumption is to make us as a community healthier, and losing somewhere like Oriental Flavor as a result, putting more burdensome regulations on, somebody like Saeed, who's been operating there for years with that open cart. I guess my question is, are we as a community healthier as a result of these shutdowns and these restrictions? I think the impact is, we're not going to see Saeed out there on a hot day. You won't be able to get a chicken gyro once it hits over 80 degrees. And I just personally don't know if we're better off as a result of this, and it's something that I don't know if this is something the board is aware of, and if not, hoping to bring it to your folks' attention. That's all. Thank you all so much for your time that you give to the community. Have a good one.
Thank you for your comments, Dylan. And we have two other people in the waiting room, but I think they're here for the agenda item about the well. If I'm incorrect and one of you needs to speak now to make public comment, please do raise your hand. Otherwise, we'll just move ahead and call on you a bit later. Okay, I think we're good.
Great. And then the next item is old business, and I think that Dylan has left altogether, but it might be, no, he's still maybe here. Just to let him know that the way the public comment works is we don't actually respond by protocol, and we can raise things during the discussion session at the end of the meeting. So we're not ignoring you. It's just the way the meeting runs. Great. So the next item of business is body art regulations. I think that's just meant to be a quick update. From Betsy and I have met since last meeting to start getting a handle on things. We are not ready to come forward with suggestions at this point, but we are moving and ticking some items off the list. So hopefully next month, if that works in the agenda, we can share with you a set of suggestions and recommendations for consideration. Everyone seems to be nodding, so I'm going to take that's fine, and no one has any further questions at this point on that. But I'll pause in case anyone does. Okay. Moving on then to new business, and I'm going to hand it over. I don't know to who, to Kiko or Susan or.
Yeah, I can start. We do have Susan with us. So I'll just give a brief intro about this first agenda item, which is related to the Craigsdorf shelter, which is at the Emmanuel Lutheran Church in Amherst, and their compliance with housing code. There was an inspections issue about the lack of a shower in the church. It's a bit of a long story, and we have gone back and forth about the best way to approach it to ensure that the guests are getting the services that they need and deserve, and that that it's up to code without obviously interfering with the shelter's operations, given this is a critical time for the shelter to be open. So with that, I'm going to turn it to you, Susan, to give a bit more background.
Thank you, Kiko. So the housing code requires that a residential building have within the building a tub or a shower located in the bathroom facilities. When I went to do an inspection at the end of December, I found they did not have a shower within the building. I was a little surprised, but we went through a bit of back and forth. They were going to request a variance from the board, but ultimately we came to an agreement that if they were to supply the bathroom with a portable shower, and there's quite a few varieties that would fit within the space, that they would be in compliance. So that is what we agreed to. I submitted a paper to you. I don't need to go into all the criteria, but we established a little bit of criteria so we would be in agreement on exactly what needed to be put in place. And we gave them a 30-day time frame in which to accomplish this. And when they have the portable shower in place, I'll go do an inspection and we'll put it before the plumbing and gas inspector to make sure everything's compliant. And then we will consider it fully corrected. So we feel that we're all in agreement. They also agreed that they wanted to withdraw their request to be heard and and we'll just agree to come into compliance in this way. So we feel this, we're all in agreement and the matter is resolved.
Great, thank you for that overview. I have one question. I'm sure others might. I'm really glad that this has come to an agreement. I'm not questioning the agreement in any way, but is this a town regulation or a state regulation?
It's the state housing code.
Okay. Great, that was my only question.
Thank you.
A question. So I volunteered at Craig's Door, and when the guests were welcomed in the evening, they were asked whether they wanted a shower or a medical visit.
So
So,
there is an off-site shower facility.
okay.
It's really on the other side of town. There's a trailer that was outfitted with a handicapped accessible shower. It's a trailer that's called, it's really located in what they call the resource center behind First Congregational Church, First Baptist Church. So that's the shower they were referring to.
Okay, great. That makes sense.
Any other questions or comments? Were the attendees here for this part? No, in the next, okay. Great. Well, I just reiterate, thank you for, I'm so glad we were able to come to an agreement that works for everyone on this. And we know that Craig's Door is in transition, hopefully to a longer, more permanent space. And so we would hate to disrupt things at this time in particular. So thank you, Susan.
Thank you.
The next item is the water supply certificate.
Yes, and then Susan, I think, so can we promote Maheen, the two folks, Mark and I believe George also, Susan, is that the driller that's in the waiting room right now?
Is it George or Ezra Cushing was the drilling, Cushing and Sons is the drilling company that addressed it. I'm not sure if that's Ezra or someone from the company representing.
Well, maybe we could ask Mark now that I see that he's here in the room with us.
Mark is the owner of the property.
Yeah, Mark, can you hear us? You're muted. If you're trying to talk.
This might be a situation like we had with in a previous meeting where the person walked away not knowing they were about to be promoted.
Oh, yeah, because I think we're a little bit ahead of schedule. Go ahead.
Yeah, I have a procedural question. When we put on the agenda the times and we're moving along quickly, I'm wondering if that's too much information on the agenda. Because we could theoretically have to wait till 4:25.
I'm here. Can you hear me?
Yes, we
Great.
can hear you. Yep.
Good. Okay, I'm Mark, and I am the owner of the property, and we've submitted, I think, everything that was required in order to get the certificate for the well. And here to answer any questions you have that I'm capable of answering.
So Mark, can I just start by asking, there's someone in the waiting room named George Carras, and I'm not sure if I know that a driller's name was Ezra, so this seems to be a different person, but should we be adding this person to the conversation? Do you know who that is?
I do not know George.
Okay.
That name I do not recognize.
Okay. Okay, so George, unless you raise your hand, I'm going to assume that you're not part of this conversation, and we'll just continue on with Mark. So everyone did receive the documents that Susan shared about the water supply certificate. Susan, do you have any background that you want to share?
Sorry, I muted myself accidentally. So I'll just say briefly that the board previously approved the application to construct the drinking water well. This was to replace a well that was struggling with consistent levels of contamination. And so the well was successfully drilled, and all of the appropriate documents for the water supply certificate were submitted, including the well completion report, the lab report, which I did review, and I found no issues. I review the lab reports using the appendix and the Board of Health regulations for private wells. So I go through all of the lists that the lab is required to test for in accordance with local regulations. And so I saw nothing of concern there. And the pumping report indicates more than adequate volume of water for daily use. I did an on-site visit and took a couple of photos of the wellhead. The wellhead looks properly secured. So I was well satisfied that all of the requirements had been met for a water supply certificate.
Great. Any questions, comments from the board? Jack?
So, yeah, it looks like a good test. I'm a little confused. The drawdown data for the pumping test, I don't really see what it was. It says the pumping water level was 320 feet. So just usually you have a drawdown. So I'm just wondering what the drawdown was. If the static was 30 feet below, with, before pumping, it was pumped at 10 gallons per minute for 4 hours.
I'm not sure if I'm going to follow all of this and be able to answer everything. So I'm looking at the pumping test report. I'm not sure if that's what you're looking at, Jack.
Yes.
The pumping water level is at 320 feet, and the recovery water level was at 30 feet static level, and the reference point was at grade.
Yeah, but it can't be 320 because that's the depth of the well, and the pump's set at 280 feet. So you don't draw it down to the bottom of the well when you're doing these tests. So it just seems like the number is in error or it didn't get recorded. But I trust if you're bumping 10 gallons a minute for 4 hours, that it's going to have good yield just by definition. But just the data is not what it should be there for accuracy, I don't think.
Yeah,
Jack,
I would.
oh, sorry.
Nope, go ahead.
I know nothing about this.
Yeah.
I'm wondering if on the state report, section 5 that says the well log, it has 2 lines. I'm wondering if that is more accurate and has anything to do with what you're asking about.
No, well, that's the geology. That's the log of the type of bedrock.
Okay, so not the 28 to
Yeah,
185 it's not a drawdown. Okay.
Yeah, so they hit bedrock at 28 feet, and it looks that code looks like it could be some bedrock formation, then another formation from 185 to 320. I'm not granite, maybe GR would be granite.
Okay, I take back my comment.
Yeah. Anyway, and the other thing, it looked like the water quality was good. It looks like, a little bit higher iron and manganese. So are you going to probably want to treat for that, Mark?
At this point, the water seems fine to us.
Okay,
And, you know, we certainly can treat it if it becomes a problem, or if we have staining that
yeah,
becomes a problem, but it looks like that from a health concern, there's not a problem. It's an aesthetic thing that sometimes people act on and sometimes they don't, and we thought we'd just wait to see.
that is correct. And then just a question for the board. The PFAS data is valuable. Amherst isn't part of the statewide program for PFAS testing in groundwater, but I'm wondering if the data can be made available to the town, and maybe the town can provide it to the state. It's always nice to have another data point, given that, you know, level of effort they're taking to understand where PFAS is in groundwater throughout the state. Is that a problem, Mark, if your data were to be provided?
No, I have no problem with that.
Okay, as another reference point. So
Sure.
Kiko, if you want to provide that to the DPW there,
Okay,
or
yes,
I could for you. It's
I'm happy to follow up with Amy at DPW about that. So
Okay.
you're saying that we, and I apologize, I don't have the documents right in front of me, but just that we do have information about PFAS concentration in this water that we can then share with DPW as, okay, got it.
yes,
All
yeah,
right.
they'd appreciate it.
Okay, perfect. Thank you, Mark, for
Yeah.
being willing to share the data with us.
Sure.
Okay. Great.
Jack, is that drawdown data an issue that should cause a problem in approving?
No, that's what I'm saying. If they pumped at such a high rate, 10 gallons per minute for 4 hours, that in and of itself is a good enough, you know, as a very screening type pumping test. But it's just missing. It really should have, you know, the drawdown.
Is it something that we could approve and then ask them to add to the report?
Yeah,
Or is it not even that important?
it's probably not even that important.
Okay, okay.
Yeah, it seems like there's plenty of water, but I guess, Mark, if you see the driller, you know, just let him know. That'd be nice to know what the final drawdown is at the
I
end
know
of the-
there was some discussion early on where the driller or Ezra had provided numbers to Susan and trying to clarify what the appropriate data was. And apparently there was a mismatch between what the town was requesting and what is considered the real data source from the driller. In terms of, there was some confusion there. And I know there was some back and forth with Susan, and the numbers were discussed when the well was being drilled and
Okay.
were found to be adequate.
And we resolved that because he did submit the pumping report. The pumping report, the way I've structured it, all comes directly from the local regulations, and the driller did fill in that information as requested.
So we're in the process of revising these regs, right?
I
Kiko,
think
so
yeah, I think that it's probably time to look at them again and make sure that all the language is what you want it to be. I think the last time they were looked at was 2011. And yeah.
Yeah.
And certainly the other thing, Jack, is that I'm still learning some of these things. I've been attending seminars, but a lot of times they're not really about this is the information we really want to see, whereas the seminars tend to be about, oh, this is how we drill the well. And not. So this is only the second drinking water well I've had to look at. So it's still a learning process for me too.
All right, well, don't hesitate to reach out to me if you want a wing
Thank you very
person.
much. We'll do that.
Betsy has a question.
Jack, just for my own education, are you saying PFAS, the forever chemicals, getting some measure of what that level is in groundwater in some of the wells being dug?
Throughout the state, yes,
Throughout
but
the
only for certain communities. Amherst is not in the program. There's like free PFAS testing for private well owners,
Uh-huh.
and it's a service that the state provided. Amherst doesn't have enough private wells, perhaps, to even go through the process. But
I just wanted to make sure I was identifying what you were talking about. So it is PFAS, the forever chemicals.
correct. Yeah, there's a groundwater database that the state has developed, and just so we have an understanding of where the problem areas are, and then how to address them, on a statewide level.
And
We
this,
have no issue. We have no issues in Amherst. Yeah,
right.
which is great.
I hear you. It's just, being part of that, not increasing that knowledge base. Was that something that they had a water sample that they could just submit to get the PFAS level, or what was how?
They use a lab specific for the PFAS. So yeah, I mean, it's a new chemical, so that
Yeah.
I don't
Yeah,
know if
Yeah, I just wanted to just understand what the conversation was. That's fine.
Yeah.
Thank you.
Jack, I have a question about the lab results. Sorry to
Yeah.
belabor it, but does the iron concentration at all or the turbidity concern you?
Yeah, well, what Mark was saying is there are primary and water quality standards and then secondary water quality standards. The secondary water quality standards include iron and manganese and some others. They're not considered, they don't really have a toxicity component to them. It's more aesthetic, color, taste, that sort of thing. So the staining. So they're called secondary for that reason. And so you can choose to treat or not treat. The primary ones would be with regard to the presence of bacteria, well, that's a main one that comes up for private wells, but VOCs, certain VOCs, and a PFAS obviously is a big one. So if you're allowed a certain amount, but if you go to the standard, then we wouldn't be able to issue a drinking water certificate for the well without treatment.
Thanks so much.
Yeah.
Great. Shall we take a vote on approving the certificate? Would someone like to motion? That was Betsy on mute who said so moved.
I'll second.
All right. Pramila,
Aye.
Gaia,
Aye.
Betsy,
Aye.
Jack,
Aye.
and I for myself. So it is approved.
Okay, thank you very much.
Thank you.
Thank you.
Appreciate it.
Thank you, everyone.
Bye-bye.
The next item on the agenda is the director's update.
Okay, thanks. Yeah, this can be brief. And Jack, I wanted to address your question from earlier about the agenda times. I think that we do our best to stick to the times that are on the agenda, but when we invite people to come and present, we do let them know. Sometimes we get to things a little sooner. So, Mark was here from the beginning. So if somebody weren't here, then I think we could, push the agenda item down, but we wouldn't just sit around waiting as a matter of sort of process. So it's okay to skip ahead as long as you have the people there that you need for the agenda item. You can sort of rearrange in the moment.
Yeah,
So just wanted to say that.
I'm tainted by the planning board experience where we actually had to wait for,
Oh,
if it was listed on the agenda at a certain time, we couldn't move on that item, or we couldn't open the item because it was a public,
I see.
communication issue. And then
Well, yeah, so I
someone from
mean,
the public could say, "Oh, you said it was going to be 420, and you were all done with it." And it's like, blah, it's that sort of controversy created.
Understood.
Yeah.
It hasn't come up as an issue for us. I suppose that could be a problem, but
Yeah.
I mean, and maybe it's a chair's decision, Risha, but generally we've been fairly flexible with these things, and I've seen other meetings be somewhat flexible too. So maybe it's the context, meeting by meeting might be slightly different, but
Yeah.
Okay, so I just wanted to briefly say that in terms of respiratory illness, it's been a really interesting season because our COVID levels are just not elevated. They're really quite low. So we're not seeing a lot of COVID infection or a lot of evidence of COVID infection in the wastewater. There's a lot of flu out there. So nationally and locally, it's a spectacular flu season. It's the worst, I think, that we've seen since before the pandemic with a double peak. So it peaked in early January, came down, and now it's raging upwards again. So, lots of hospitalizations for flu, and other kinds of influenza-like illness out there. Human metapneumovirus virus, parainfluenza, all sorts of delightful things. So that cause like slightly less intense, but still significant inflammatory responses in people with fever and cough and whatnot. So I'm just really recommending that folks be cautious. We're in the middle of it, respiratory illness season. So, wearing masks, staying home when you're sick. Really, the guidance for everyone is if you're fever-free for more than 24 hours without the use of fever-reducing medication and your symptoms are resolving and you're feeling up to it, it's okay to resume your activities, go back to work, but to wear a mask for, a couple of days until you're really feeling sort of more back to normal, just to keep infection at bay. So that's what's happening with respiratory illness. And then I did just update the public health update section of the public health department web page with some information about avian flu. I think some people who don't really understand how avian flu and human flu work were thinking, oh, flu rates are through the roof. Does this somehow have to do with avian flu? And it does not have to do with avian flu. Avian flu at this point is really an animal illness. I mean, it can spread to humans, and there have been 67 avian flu cases in the country so far. But what we do know about avian flu in our area is that it's widespread in the wild waterfowl population. So Canada geese, ducks, safe bet that there's avian flu circulating in those populations. The geese at UMass Amherst, that was in the news a week or so ago that a couple of them tested positive for avian flu. That's really not surprising. There have been mass die-offs in some places, like in Plymouth, I think there was a lot of geese that died. I think there was something in the news today about Chicago had a lot of dead geese. So this is sort of a pandemic for geese, this avian flu. And the way that it can get into poultry populations is that, those geese flying overhead, their feces can contaminate domestic birds. So the recommendation for people with backyard flocks or poultry operations is to keep the birds indoors to try to prevent exposure to wild waterfowl, because that's really where this disease starts. It's possible for men. There have been cases of a fox that tested positive. There have been a couple cases of cats with avian flu, and cats are quite susceptible. So the mortality rate is quite high, more than 50% in cats that get avian flu. And cats can get it by being exposed, if they're outdoor cats, to people who have backyard flocks, if they eat birds that are dead, or also through raw milk or raw pet food. So it's really recommended that people who have cats not feed them raw milk or raw food, because that is a potential risk factor. And there have been some recalls of raw pet food because they were contaminated with H5N1, which is the avian flu virus. Also, the recommendation for humans is not to, if you come across deceased birds, not to handle them. If you have to handle them, glove up, put them in a plastic bag, put it in the garbage. And if people find, large amounts of dead birds, there is a number to call, which is on the website for people to report them. And if people have backyard flocks that appear to be infected, there's a poultry reporting form that folks can use to report this. So basically, The 67 cases that I mentioned, most of those were people who were infected through contact with dairy cattle. Massachusetts has been testing dairy cattle since August. We were very proactive here in the Commonwealth. Before there were even any cases in Massachusetts, we started testing. There have been no cases of avian flu or H5N1 in dairy cattle, and we're very much on top of that. It doesn't mean that raw milk is not still a liability, and I think the general public health recommendation is not to drink raw milk because it can have other pathogens. So that's just general advice, but no evidence of H5N1 in dairy cattle in Massachusetts. Other people who've become infected with avian flu there was one person who got it through a backyard flock. That was somebody in Louisiana, an older person who did end up dying, the only fatality that we know of. No documented cases of human-to-human transmission. So this is very much something that's in the animal population with occasional spillover into other populations of mammals, wild mammals, humans, but not spreading among humans. And the ticket is really just to keep it that way. So if you do come in contact with deceased birds or other possible vectors for this, to really handle those carefully. So that's just the update. I think we will push it out as an alert to people because it is in the news a little bit. And I want to make sure that folks in Amherst are aware of, what's happening. So just so you are all up to date as well, and you can go to the website to look through everything I've just said. I think those are really the main updates for us, for me. I've been focusing a lot of energy on preparing for what's happening in 20 minutes. So looking forward to having this hearing. To thank you all for your flexibility in changing from an in-person to a virtual. It was a tough decision. I went back and forth on it, talked to Risha. We just felt like it was better to be safe. The roads have been a little sketchy, and other things have been canceled. Town offices are closed. So I feel like it's better that we're holding this virtually. And we will plan to promote people who are speaking to panelists so we can see their faces like we did with Mark just now, rather than just allowing them to talk in the waiting room, which is sometimes what we do. So I think that'll be better. We want to have as much of a possible replication of an in-person experience as we can. So, but just to review, I wanted to take a minute, and we'll have a little bit of a break in between, but I just wanted to ask if anybody, just to review that this is really just listening. So there's no back and forth. People will make their comments. Risha, in the script that we put together, we had said 5 minutes, but in talking with Cheryl Sabara, who is planning to log on today, she's with MAHB. She's come to our meetings before. She's a expert in all things tobacco. She said 5 minutes is really a long time to talk. And if you have a lot of people, you really might want to limit it to 3. So I think since we put it out there that people had 5 minutes and folks may have prepared testimony that is that long, I think what we can say, Risha, is that please try to limit your testimony to 3 minutes if you can. If not, the max is 5, and we will absolutely cut you off at 5. So hopefully people can kind of be a little bit more brief, and that will just make it for a less lengthy process. Does that sound okay to you, Risha? I sort of came up with that idea. Okay. And then does anybody have any questions about it before it starts? What to expect? Anything at all? I guess not. Okay,
Kiko,
good.
I have 1 or 2 technical questions, but maybe we can stay on after this meeting
Excuse me. Yeah.
stops.
Okay. That sounds good to me.
Great.
So again, it's really just a listening session for you all as board members. And then sometimes that we set these things up where the board votes afterwards, but that's not the way we've set this up. This is a listening session, and then there'll be an opportunity for us to talk about it at our next meeting. That's the way we've framed it. And all of the written testimony that has come in, I will not be reading that out word for word. I'll be just summarizing it, and you'll all see it later so you can digest it before we meet again in March.
Any questions or comments on any of her update, including the hearing? Okay, if not, there's a section for things not anticipated within 48 hours. I would like to know, based on the comment that was made in the public session, in the public part, if we're aware of the halal cart. Is that a health issue? Is that coming from the health department or some other part?
As far as I understand it, there are, the health inspectors enforce Massachusetts food code. So they don't come up with their own ideas about how things should go. I know it might seem that way to the public, but they're just very detail oriented. Susan's still here. She can, attest to that. So I think there is there's something happening with the halal cart. I'm not privy to the details in that it's not up to code. There's something about the sink that needs to change. So I can understand that people might be concerned about that, but it is about being compliant with code. So, I mean, I can certainly convey to Sasha that there was some concern on the part of a community member about something going on, and we can figure out whether there's any kind of messaging that needs to happen, or maybe that person just needs to have a phone call. I'm not sure. We can figure out how to handle it.
Sure. And I'd appreciate an update at the next meeting just to understand which part, like he mentioned 2 parts, the sink and then the sort of covering.
Yes.
And just to understand the sink seems more straightforward, although I don't know the exact violation but the covering I'd be interested in understanding, because it does, some of the regulations around allowing food trucks, I think are not public health or are not health department. I think they're the more, zoning regulation or whatever that is in the town. So just trying to understand the whole thing, I think it would be useful to have an update.
Yeah, I think that would be valuable for the board to just understand in general, because mobile food is different from, brick and mortar.
Yeah.
So yeah, we can do that for the next meeting. Great.
Susan, I noticed you came off of mute. I don't know if you had wanted to say something.
I was just going to offer to say that our process as inspectors is, yes, we're enforcing a minimum standards. And sometimes certain standards have not been strictly enforced by previous inspectors, and we grant a lot of time to try to help people come into compliance. I know in this particular issue, the 3-bay sink, he's had 6 months to come into compliance. So we do have a process. I just want to keep it brief. We have a process, even though we're trying to enforce standards. We try to be sensitive to people that, they're trying to correct something that could be really expensive or has not been strictly enforced in the past. And we try to work with them, but no one's always happy. And certain beloved institutions like the halal cart are in the public attention. So we're trying to be sensitive and to all that. Thank you.
Thank you for that update. Okay, if there is nothing else, the next thing would be a motion to adjourn.
So moved.
So sorry, before we adjourn, I have a quick question.
Yes.
I know in previous years before I joined the board, I think most of the members joined, there was a real initiative to establish mental health outreach in the town of Amherst. I'm wondering if that's something coming back up.
Let's see. We did do some work on that last winter, spring. And it was a kindness campaign and some other ideas. It's something that we have not been talking about recently, just because there have been so many other things that we've been focusing on. But I do think it's still very much an important issue that we should try to focus on as a public health department. So we can talk more about it. I'd be curious for your ideas if you have any thoughts about what we could be doing. But yes, definitely still an interest in that.
Sounds great. Sorry for the last minute.
No,
intrusion.
and that might be one of the issues that you want to just have a conversation with Kiko. It doesn't actually come to the board per se. It comes more to the Department of Public Health. And so you should feel there's no meeting laws about talking to her about that kind of work.
Thank you.
Thanks.
All right. Jack, do you want a motion again?
Yes, move that we adjourn the meeting.
Can I get a second?
I'll second. Or
All
Betsy.
right. Betsy, are you
I'm
yay
on,
or nay?
yes.
Pramila?
Aye.
Gaia,
Aye.
Jack,
Aye.
and myself. Aye. And can I ask Maheen and Kiko to stay on just for technical questions? But can we end the public part of this meeting at 4:40?
Yes, I can do that.
We use the same link to get back on for,
No, it's a different link.
okay, all right, I'll look for
Yeah.
that.
Yeah, in fact, Risha, I think it might be better for us to join the other link, the practice session, just
Sure.
because this will continue to record and I don't think they can cut it off. So that means they'll post this whole thing with our other conversation.
Sure, happy to join
Okay.
the other
So
one.
let's, okay, thank you.